Hey, how you doing? My name is Khadija Green. I'll be your nurse for today. Today, I'll be administering you your IV fluids and your meds. But first, I'm going to provide you with privacy. Make sure my bed is locked in your working position. Make sure your side rails are up. Check your armband. Okay, what's your name? Date of birth? Jack Smith. John Smith. 115. 8 have an allergy to penicillin and aspirin. All right, I'm going to wash my hands and put on my non-sterile gloves. All right, Mr. John, today you are going to be getting 500 of normal saline for your hypertension going at a rate of 775 cc's an hour. You're also going to be getting antibiotics because looking at your blood count levels. Your levels are a little high for your white blood cell count. Then we are going to be giving you some laces before you get discharged home. First, we are going to program our pump. Start with the primary line first. Okay, I got all my lines labeled. Everything airs all out of my lines. Starting with my primary line, I have my pump with me. Hear it. Okay, beep, 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 power on. All right, new patient, new channel. Got the was running at 500 mLs an hour. All right, got that part done. Want to make sure that's dripping because it's not starting unless it's dripping. My mar with make sure I got everything that I have so far in my pump right with my mar. All right, my fluids are going to be running at 500. Nope, it's going to be 500 for my saline. Okay, so 500. You said new patient in the channel. Okay, that's correct. Okay, so you get 500 of the normal saline at 75 mLs an hour. 75 mLs an hour. That's dripping, so the primary line is set. Now I'm gonna get my alcohol so I can clean my port. Starting with my port that's closer to me. Take my top off and clean that. I'm gonna hold that in my hand to keep that sterile. Now I'm going to prime my secondary side of the pump. And comparing it to the MAR, we're going to give him his antibiotic Kefazole, 175 milligrams every hour. But after doing my math, he's going to be getting 6 mLs every hour of the Kefazole antibiotics. All right, channel, patient. All right, that's going. Now I'm going to give another alcohol to clean that port of that one, of that line. Okay, carry those together. All right, now I have both of my lines married together. I have drops on my secondary port right there. Now we're going to attach it to the patient. I'm gonna get some of the gloves. I'm changing my gloves, washing my hands. All right, Mr. Jack, I got everything set up on my IV pump. Now I'm gonna connect them to you. Okay? Is that okay with you? Yes. Do your site feel pretty good? No pain, no swelling. Okay. All right. Put on my new gloves and my goggles. I'm going to first flush the lines. Have my normal saline. Aspirate as such. Okay. Move my old one that was there. Twist that on there. Aspirate. Pull. Okay. We got that one. Now we're going to connect. Follow myself. Okay. Won't hurt to clean this port again. Remove cap. Close that again. I'm gonna check my MAR to make sure because anything can happen. Okay. Got Mr. John Smith looking at his armband. John Smith with a date of birth of 1/15/58 has allergies to penicillin and aspirin, so that's not none of those. Okay, we're running the normal saline at 60 mLs an hour, and you're getting your antibiotic 175 milligrams, which is no, your 500 normal saline was 75 milliliters that you get in an hour, and then the antibiotic getting that at 60 mLs an hour. So at this time, I'm going to get to my patient. Okay, everything's running good. I'm going to secure the line, tape, or if I had a stat lock, that would have been good to use as well. As soon as I get that prepared. Alright, I'm going to secure it. Okay. Alright. To start my pump. Alright, Mr. John, we have everything rolling at this time. I'm going to lock your bed. Make sure your arm is arm side rails are up. I'm gonna come back in about 30 minutes to check on you, okay, and to check on the bag and make sure everything is flowing properly, okay? I'm now removing my gloves and my goggles, and I'm washing my hands, and everything is dripping as such, okay? And I'm washing my hands and removing my gloves, and I will be right back. And I'm documenting the route, how the patient tolerated the how it was, is everything intact, the site, and the antibiotic, the flow, and stuff like that. That's all.